IAB and the subject, FNDS, a new society for functional neurological disorders with Dr. Mark Hallett. Functional disorders describe non-organic disorders. They occur in many medical specialties. In neurology, they are particularly frequent. Many of them are movement disorders. Our guest today is Dr. Mark Hallett. He is chief of the National Institute of Health Medical Neurology branch and chief of its Human Motor Control section. He was president of the International Federation of Clinical Neurophysiology and the International Parkinson and Movement Disorder Society. Recently, he developed a special interest in functional movement disorders. Mark, why did you become interested in functional neurological disorders?
Yes, hi. So let me give you two reasons for how I got interested in functional neurological disorders. The first has to do with an observation that I made about maybe 15 years ago. I have a movement disorder clinic, and this is for referrals of patients that I get from all around the United States. And at some point, I was looking at the types of patients that we were getting, and I saw that about 30% of the patients that we were seeing had functional movement disorders. And I looked around and found that there was very little work going on in how the patients could be identified, how the patients should be treated. And I recognized that there was a major problem that these patients were being fully neglected by neurologists and psychiatrists. So I thought it was important that someone take a look at the situation. The second reason that I got interested is that I'm interested in the way that the brain controls movement and its pathophysiology. And one of the very interesting things about patients with functional movement disorders is that while the movements look like they are voluntary, the patients say that they're involuntary. And I fully believe that that's the case. This is an involuntary disorder. But why the brain should produce movements that look voluntary but feel involuntary is a very important question just in terms of how the brain operates. So I think that not only is it an important clinical problem, but it's a very interesting basic science problem to understand the way the brain works. So that's why I got interested in it, and it has these issues have maintained my interest over the years.
What are examples of neurological functional disorders?
Yeah, so the typical features of functional movement disorders really span the entire spectrum of movement disorders. They can really be anything. The most common is tremor, but one also sees gait disorders, myoclonus, tics, dystonia. Functional disorders really can mimic anything in movement disorders, and for that matter, anything in the whole field of neurology.
And how frequent are functional movement disorders?
Yes, they turn out to be very frequent. As I mentioned in my own clinic, it was 30%. So 1 out of 3 patients had a functional movement disorder. Now, I think as more people have become used to these patients, the number of the sort of percentage of those patients has declined in my clinic. But evidence shows that in even a general neurology office, perhaps 1 in 6 patients might have a functional disorder of some kind. And if you emphasize movement disorders, it would be, 1 in 6 or something like that in terms of the frequency. So this is a very common disorder. It isn't a rare disorder at all.
And what do we know about the underlying psychological mechanism of functional disorders?
Yes, so this is an important question. The issue is, what is the fundamental cause? What is the reason that these patients develop the abnormalities? And it has been thought that psychological abnormalities or so-called psychological pressures are important in causing these disorders. And to a certain extent, that's true. There are important psychological factors. There is a high comorbidity, for example, with depression and anxiety. However, that's not all the case. There is a fundamental biology that we're beginning to understand. There are important sociological aspects that are also relevant. And I think that as we learn more and more about the entity, we can see that it is really just like almost any other problem in neurology, a multifactorial disorder with many different facets.
Yeah, you mentioned it before, but where do psychology and neurophysiology meet?
Yes, well, I think that this is exactly what I was saying. There are multiple different aspects to this. And in terms of the psychology, I view that to some extent as an etiology. And the neurophysiology is a pathophysiological process. So the situation, as I think about it, is that etiologies influence pathophysiology to create a particular phenotype in an individual. So clinical neurophysiology sits in the middle as an explanation of how, for example, psychology creates the phenotype. But it also helps us in making the diagnosis on some of the patients. Some of the time, the diagnosis is a little difficult, and clinical neurophysiological testing can be helpful.
Yeah. And where we are with respect of therapy?
Yes, I think that therapy is still lagging behind to some extent. But as we learn more about the etiologies and the pathophysiology, we're doing better with therapy. The first step, which I think is now much more universally recognized, is that we have to be straightforward and clear to the patients what their diagnosis is. We have to be sure that they understand it and accept it. This is an important first step in treatment. Then there are a number of different approaches depending upon the different type of disorder. With respect to movement disorders, it is very interesting that psychologically supported physical therapy can be very helpful for the patients. In this psychologically supported physical therapy, patients are reminded or told that they really are capable of doing things normally. And the physical therapist can show them how they can do things normally. And with that background information, they can improve very quickly. I think, however, in a number of patients and for some particular disorders that where physical therapy isn't perhaps indicated, psychologically based therapies such as cognitive behavioral therapy can be very helpful for the patients as well.
Yeah, true. And why was it necessary to start an international society on this?
Yes, that's a very important question. We started an international society a few years ago, and there were several reasons for doing it. First, as I mentioned in the beginning, knowledge about these disorders is not as good as it should be all through the medical profession. So that we really do need to increase education. And because it is a disorder that falls somewhat in the cracks between neurology and psychiatry, neither neurology or psychiatry really addresses the problem as a central one. So, and it is also the case that we need neurologists, psychiatrists, psychologists, physical therapists, social workers, all to work together in the same group. Well, there are no societies where all those different professions get together. So we felt it necessary to get all the professions together to work in a harmonized way, to first work together, and second, to increase education to all the people that need education so we can help the patients.
You would say this is the goal of FNDS, to get together the people, or what is the goal? What would you say?
Yes, well, the goals are, of course, in the end, we want to help the patients. That's the major goal of any health-related professional society. We want to help the patients. Well, how do we do that? Well, we do that by education as the first step. We have to make sure that people know what these disorders are, how to help patients, and education is really critical. We are finding that it is probably going to be necessary as well to help make sure that we have good definitions so that people understand what the situation is. We probably will have to support research activities of various kinds. So there will be a lot of sub-goals along the way, but the main goal is to make sure that the patients are as well treated as they possibly can be.
Sure, great idea. And who can become a member?
Yes, so we are very welcoming to everyone in the healthcare professions to become a member. This is what is somewhat unique about this particular society. So we already have about 800 members. We've only been around for about a year and a half or so, but we have about 800 members already. Neurology, psychiatry, physical therapy, psychology, occupational therapy, social workers, all different professions. Many different students who are training in all these fields are also joining, so that we really have a multidisciplinary group. It's very easy to sign up. You just go to the website, fndsociety.org, and you can sign up to be a member. Lots of education, and hopefully it will be a valuable way to interact with people that have similar interests.
Yeah, great. And what's your outlook?
Well, the outlook I think is good in the sense that we are clearly making progress in this area. As I say, there are a lot of people who've already signed up for the organization. Education is increasing. I'm finding that more and more people are knowledgeable and want to learn more about the situation. But I'm afraid we have a long way to go. A long way to go. There is a lot more education to be done. And in terms of therapy, we still lack a sufficient number of educated physical therapists, for example, physical therapy programs, psychiatrists that know how to do the right type of cognitive behavioral therapy. We're really in a problem with this worldwide. So we have a lot of work to do, but we're making progress, and we're going to keep on plugging. Of course, it's a common problem, as I say. So we do need to be all working at it together.
Yeah, we hope the best. It's the same with IAB too. That's a long way. Okay, many thanks, Mark.
Okay, you're very welcome. Thank you for the opportunity.
Thank you.